There we
Is it
go.
on? It's on Instagram?
I think it's on Instagram,
Oh
LinkedIn, YouTube, I want to say. But
boy.
welcome everyone. Excited to do another live stream here. And really excited today. My guest is Alexa Sloane. I encourage everyone go to the Stay Off My Operating Table podcast. Look up the episode we did a while back. Alexa is a functional diagnostic nutritionist, as well as a nurse. Did I get that title right?
Yeah, you did.
Yeah,
Well,
very good.
nutrition practitioner, but
All right,
yeah.
nutrition practitioner. And she's got a lot of awesome information for us that we're going to talk about. And we're going to talk about how, nutrition kind of plays into the overall, concept of functional wellness. And we're also going to talk about spiritual health, which I think is an important component of all this as well. Full disclosure, Alexa is also my cousin, or
I was
my,
gonna say,
my
I never
cousin's.
know.
Yeah.
I always want to say uncle, and I'm like, that's not right.
Well, so I actually looked this up because I wasn't quite sure. So technically, you're considered my first cousin once removed, but they say commonly people will refer to them as, you're my niece and I'm your uncle. So,
Yeah,
but it just kind of seems weird to me to be called.
cousin feels weird.
Yeah. But so anyway, Alexa is related to me, and but that's not the only reason that I think she's awesome and what she's doing is awesome. But good to get that out there. So, Alexa, why don't you give your background, a little bit more of your background to everyone, and then we'll kind of get into talking about spiritual health and functional wellness.
Okay, perfect. So my name is Alexa Sloane. Like Phil said, I am a registered nurse. I will work full time in the OR. I am also an FDN-P and a certified holistic nutritionist. So I would say this whole functional medicine journey began during COVID. I was a med surg nurse. I was working nights during COVID, and I just saw everyone getting extremely sick, and I didn't understand why no one was talking about nutrition or anything having to do with preventative measures for health. On top of that, my grandma was struggling with horrible diabetes, and so during COVID, her mind just tanked. And I remember I was like, I never want to end up like that. And so I tell everyone I fall down these like rabbit holes in a sense. So now I'm in like my spiritual health rabbit hole, the nervous system rabbit hole. But at the time, I was in a whole blood sugar rabbit hole during COVID and with my grandma, and I started doing CGM and all this stuff. And I would say that was like my tipping point into functional medicine and, getting my certifications and all that.
Yeah,
So yeah.
and I think that's a great, one of the things I see consistently, right, is, practitioners who are looking around them. They're kind of seeing the healthcare environment, the system around them. They're seeing that their patients aren't getting better or maybe are actively getting worse. And, this extends to friends, family, and you just want better, right? You want to help more. You want better results for your patients and the people around you, and that's what leads people to these other avenues that, quite frankly, our traditional healthcare system is failing at. And you see a lot of what I see, right? You're in the operating
Yeah.
room. And yes, for acute problems, right? We do great. Our healthcare system does great. You need surgery. We have the best technology, I think, in the world, and the finest surgeons, and all of that, all that goes with it, right? The staff and all that is great. But when it comes to chronic medical problems, both treating and preventing them, we do a very lousy job. And I think more and more practitioners are waking up to that. So maybe give people a little insight into what,
What I do with
functional,
clients.
yeah, what a
Yeah.
functional diagnostic nutrition practitioner is and does, and what kind of training you receive for that.
So for the functional medicine certification, that's done through FDN, and that was about. I did that. I finished a year ago. It took me a year. And really, what it is it's a lot of education surrounding functional lab work. And you've had Reed Davis on the podcast before. He founded FDN. So he goes into and he talks about all the stuff that we talk about in functional medicine. So like blood sugar, we talk about, leaky gut dysfunction, HPA axis dysfunction. We don't, not that we don't care about your diagnosis, we do, but a diagnosis to us is just a cluster of symptoms. It doesn't really mean anything. We like to look underneath the diagnosis, like looking under a stone. That's what I do with clients. I do things a little bit differently in FDN in that I have started to change the lab work that I run, but still the core values are all there. So the program is really based off of the lab work. And then towards the end of it, you have practicals and you really have that integration. And then you're off to the races. But I love FDN. I think they have a fantastic community. The way I diverge is just I've been learning new labs and and Reed talks about this. He talks about nervous system stuff. He talks about your soul and purpose and all that and living out of alignment. But he doesn't really go deep into it. And so that is what I do with clients. I really try to get into that whole nervous system stuff and the spiritual stuff because I think that is a huge, huge crux of healing that a lot of practitioners just completely they won't touch it because I think it's heavy, but I think you're doing the client a disservice if you don't at least bring, some self-awareness, some self-reflection.
Yeah, definitely so. And I think the reason, that it's hard maybe for practitioners to incorporate uh, is, you don't have a lab test for it, right? You can't
Nope.
necessarily measure it. And, so it becomes, it gets viewed as sort of a, woo woo kind of softer
Mhm.
thing. But the reality is that it is important, right? And
Yeah.
when I talk about the pillars of metabolic health, right, I talk about the stress component, and this certainly plays into that, right? Having a community and having thinking about your mindset. These are all very important when it comes to wellness and it comes to health. So how do you approach that with your clients? How do you start to bring that in? Because I think oftentimes people go to a practitioner, right, doctor or elsewise, right, and oftentimes it is very much around the data. It's what do your labs look like? What can we do to affect this lab or this symptom that you're having? But how do you start to roll the spiritual, the kind of neuro part into your practice?
So the framework that I follow with clients is I really focus on it's almost like tiers of health. So for this one program that I run at Soul Functional Wellness, that one is very much spiritual work based, but it's almost like peeling back an onion. So I start with the physical. I do the diet, I do lifestyle, environment, I do a whole assessment of that. And so, because if you can't self reflect if your blood sugar is going bananas, you're going to be super reactive regardless. Like if you had a tortilla for lunch and that's it, you're not going to journal. You're not going to, nothing's going to be positive. You know what I mean? Like, so I had to get that under control. And then I start to peel back this onion. And I just came out with like a nervous system workbook that I give clients. And honestly, it really comes out over the months that I start talking to them and just getting a sense of their life. We talk about like the nervous system stuff. I have educational modules. I go into like what I've been through just with like COVID, some traumas, OCD journey, whatever. And whatever resonates with them, we talk about. And so I feel like I've developed this sixth sense almost for like these blocks in clients, these energetic blocks. And so I will kind of work through these dysfunctional behaviors that come up, like perfectionism, coping mechanisms, right? Like rumination, overexercising, workaholism, etc. And so I work through those dysfunctional behaviors with them, almost like cognitive restructuring. And yeah, I get them to show up differently in their life. And eventually, what ends up happening is I always say my clients like become the light they inspire change in other people. That's always my aim for them. Um, so I always say when you get to that place, when you've peeled the onion back so much, you can really differentiate in your brain almost like ego versus soul, right? Like mind versus heart. I get my clients to a very heart centered place. That's where they live their life out of. I do other stuff too. We talk about boundaries, values. I really get people to reconnect to who they are. And I think when you're in that space, there really is not a lot of room for anxiety because you are living in alignment. I don't think there's a lot of room for um, other diagnoses that Western medicine is going to give you. I think you have mind, body, soul healing in that place.
Yeah, and then how do you think that then sort of plays back into right doing the success with um, what we'll call the basics, right? Eating right,
Hmm.
exercising, getting activity.
What do you mean, like in the spiritual sense?
Yeah, well, once you address these spiritual issues, do you see that kind of helps with the other,
Oh my God.
components?
These girls, it's like an energetic weight like drops off. I should have said I'm certified in Reiki 1. And Reiki is a very, very spiritual practice. But I think that the Reiki piece has helped me so much in picking up on these things with clients. I really, what I'm doing secretly, they don't know this, but I'm just inviting presence into their daily life. I'm getting them to slow down because once you slow down in whatever way that you're doing it, usually I like to get them into nature, hiking, even sauna. Like I had a client once text me, she was like, I just had a panic attack in the sauna because I don't want to sit alone in my thoughts. And I was like, okay, so we're gonna do that again. Like, and we're gonna think about why you have such a hard time sitting with yourself. Um, but yeah, I'm able to pick up on these things with them and they change right before my eyes and they come back to me and they're like, wow, I don't have period problems anymore. Because some of them have a really bad relationship with men. Some people have victim mentalities. And it just coincides with all of those physical symptoms that they bring to the table.
Yeah, great. So what, you know, let's give people some sort of tips, some, what are maybe one or two things that most people, will be sort of easy for them to start to incorporate into their daily life when it comes to this.
When it comes to spiritual health, well, one, I would say start like start paying attention to the way that you talk to yourself. That's a big one. Pay attention to how you talk to yourself when you fail. Your inner dialogue means a lot. And I also think that people need to, you know, become comfortable being uncomfortable. Because in order to connect to your heart space, I think that's a very growth centered space. And I think a lot of people don't want to do that. A lot of people want to stay stagnant in life. I think they're okay with just the mundane, whatever that is. Maybe the job that you don't like or the relationship that's not really serving you anymore. But again, these are things that make us physically ill. Um, so I think when we slow down and inviting a practice like that, whether it be like getting into nature, even staying off your phone in the morning for a couple of hours, not doing that dopamine hit right off the bat, even the way we eat, like sit down with your food and don't put anything on. Like that is so hard for people to do, but it's in those moments of presence that you really hear yourself, you know? Like your soul comes through to you.
Yeah, no, great pieces of advice. I think getting comfortable with sort of being uncomfortable is one of the
It's
big ones
huge.
that I talk to people about, because even when you look at sort of paradigms around heart disease, right, that I deal with all the time, and it's kind of the easy path, right, is just follow the guidelines, just
Yep.
take the medication that the doctor recommended, or the guidelines recommend, and doing things like working on your diet and working on your lifestyle, and kind of challenging these paradigms, and taking a different route. um, you know, you got to be a little comfortable with being uncomfortable, like you said. And I think that can be great advice for everyone. So, in the last couple of minutes, let's kind of go back to a little bit around the beginning of the discussion, and talk about how you see all of this integrating right into uh, healthcare, right? And for people that maybe have one of those diagnoses, right? Let's say they have
Mhm.
diabetes, very common, right? And there's sort of the standard paradigm around that. And with all that you've learned, and you continue to learn, how do you think it integrates, right? Should people ignore all of that and you only do this, or do you think there's a mix? What do you
There's a
think is
mix.
sort of ideal moving forward?
Um, I think it's a mix. I mean, if you can't look at somebody's diabetes and say like this is, of course, diet is a huge contributing factor. But we also know like the makeup of your microbiome is also a huge contributing factor, right? To lipids, to glucose, to whatever. But then of course, it's like these branches, you see coming out, like the diabetes, and it's like there's just we have to look at health, we have to look at the whole person. And I think that's what functional medicine really is. And I think there are obviously some, doctors out there that do the labs and they give the supplement and it's functional medicine, but you're still doing it's a supplement for every ill type of thing. But really what I do, and I hope that we do this in the future. I have no idea how healthcare could possibly change in this way. Um, Truly, I mean, my hope is that it will, but to seriously look at the whole person, look at what they've been through, look at childhood wounding, look at the behaviors that people play out in their daily lives, patterns of behavior, the same situations, experiences that keep replaying in your life. It happens for a reason. It's because you need to learn a lesson. And I think when you do that, and also as a society, we are so addicted to adrenaline. It's downright scary. And so emotional states like anger and these things get addictive. And so you really have to unpack all of this. And the only way I think to truly do that is to slow down, which a lot of people don't want to do because then your mind starts talking and you don't want to hear what it has to say.
Definitely so. And I am optimistic about, kind of the future of medicine and being able to integrate it. Obviously, it's something we're trying to put into practice every day at Ovadia Heart Health. And I do see, more of my fellow, traditional doctor colleagues that are starting to think about this stuff, starting to explore it, starting to recognize, where we're falling short in the traditional medical system, and looking for answers outside of it. And I think the more that we can collaborate, on these types of things, the better, and the better for our patients. Awesome conversation today. I think people will really gain a lot of information from this. to follow Alexa. Instagram is the best place. She's over at The Metabolic Maven. So I certainly encourage people to go check her out there. Anywhere else people can kind of find your stuff, Alexa, or connect with you?
I am on TikTok now. I feel like my Instagram is more like my portfolio. It's got the recipes and the labs and stuff, but TikTok is like my spiritual like health playground. So if you're into the woo-woo stuff, I would go on TikTok. If you're into the more like business casual, go to Instagram.
That sounds great. TikTok is a area
Is the
we have.
metabolic maven too.
Yeah, we've only started to dip my toes in that pool there, but awesome. And yes, please go follow Alexa on either of those places. And we as like I said, at Ovadia Heart Health, right, we're really looking for ways to continue to expand our holistic approaches to patients with heart disease, with diabetes, with metabolic issues of all sorts. And love seeing your journey, and love seeing how you're developing this practice as well. So thanks for coming on. And
Thank you, Phil.
great talking with you again
You too.
publicly. And we'll probably be doing more of this in the future. For everyone out there watching, please also follow this channel, whatever you're watching it on, and comment. We love hearing from you what topics you want us to talk about. We've been trying to do these live streams a couple of times a week. And we really want to hear feedback. So please comment, let us know what you want to hear from us, and we will see you next time.
Bye.